Good morning, everybody. I'd like to welcome you to the NYU, the School of Global Public Health's Earth Day Symposium. It's a panel discussion on climate action and resilience in the age of COVID-19. I'm Chris Dickey. I'm a faculty member at GPH. I also direct the global health and the environmental health programs at GPH. In addition to the privilege of being able to work with so many gifted students, I have the real honor every day of working with a faculty that is at the top of the field and the top of its game, and you're going to meet several of them during this seminar. Just a quick introduction, and I'll hand it to my colleague, Bill Rahm, Dr. William Rahm. We started this back in September, which by my calendar is about 350 years ago. When we were inviting our students to think about what they wanted to focus on during the time they were at the School of Public Health and at the School of Global Public Health. And so we polled them. We talked to them about what they want to work on, and almost all of them immediately thought that climate change was the most pressing global public health issue that they wanted to work on during their time as an MPH student. So we challenged them. We said to them, what would you like to leave behind? You know, do you want to just be a passive intake of information and ideas from the faculty, or do you actually want to do something? Do you want to make something and make something happen? Which they responded to. And so the Climate Action Challenge was born. And so until we were all locked down into our homes by the global pandemic, our plan had been to do an action challenge where we would have students working on projects that would actually help mitigate the effects of climate change and help to alleviate some of the stress on our society. It's ironic that many of the things that they probably would have come up with are things that are going to be helpful to mitigate the effects of the global pandemic. And so the two are not unrelated in any way, that the fact that the world has to respond to this incredible challenge. And so we, in our adjustment, we've changed the active challenge to this very, very exciting panel discussion. I would look at this as a launching off point. I'm hoping that what will happen is that the remarks today and our discussion is going to motivate those of you in the audience, and especially our students, to really take on the challenge of doing something about both the response to the global pandemic and to the climate change challenge that we're all facing today. Introducing Dr. Julie Tighe, who's the New York director of the League of Conservation, the director of the New York League of Conservation Voters. We're tremendously honored that Julie has been able to give us this time today to give us some remarks. And what I'll do is I'll ask maybe Julie if you want to start your remarks, and then we can have Bill do the reverse introduction when he makes it to the webinar. So thank you very much, Julie.
No problem. I would be happy to do that. So as Dr. Dickey mentioned, my name is Julie Tighe. I'm the president of the New York League of Conservation Voters, and obviously, I, like everyone else in New York City, I really hope everyone is staying safe and healthy during this difficult time, where I felt very fortunate that this morning at 6:30, Fairway had toilet paper. That's where we're at in life, whereas, as you pointed out earlier, 350 years ago in the beginning of March, that would not have even been a question. I want to thank you for inviting me to be a part of your celebration of Earth Day's 50th anniversary. Today is actually also the 50th birthday of the New York State Department of Environmental Conservation, which is where I spent more than a decade before joining the League. And even that, I actually just posted this morning, you know, I often consider myself an accidental environmentalist. Like you, I went to graduate school for public health. And at that time, while there was an environmental health program, it was not the big emphasis. This was back in the days before we had prescription drug coverage by Medicare, before we had a much broader coverage of healthcare. And so I was working in the healthcare field for the first 6 years of my career. I went and I worked for an assemblyman who was chair of the insurance committee, and I worked on health insurance policy and health policy. And then we had a governor who made my assemblyman the commissioner of DEC. So I transitioned from public health to environment, not on purpose, but because sometimes, you know, the road of life takes you where you need to go. So I joined the League of Conservation Voters in 2018, and at the League, we advocate for the environment by helping to pass laws and holding elected officials accountable for their positions on the environment. What makes us unique relative to other environmental organizations is that we endorse candidates for federal, state, and local office based solely on their positions and actions related to the environment. And nowadays, that basically means their positions and actions on climate change, which is clearly the most pressing issue of our time. It affects our health, our communities, and our economy. And the COVID pandemic really underscores the link between pollution and public health. I'm sure you've all seen the recent Harvard study finding the correlation between neighborhoods with the worst air quality and poor health outcomes among those infected by the virus. And this is just one example. If you look around New York City, you'll find that people who live in areas with more pollution also experience respiratory illnesses like asthma. In fact, the CDC says that asthma is the leading cause of school absenteeism, and that's something that we've used as a tool to help get changes in policy made. Because if we want to combat these effects, we have to start combating climate change itself. We need to adopt laws and regulations that reduce pollution and protect our environment. And we need to take actions ourselves. Fighting climate change requires an all-of-the-above approach. It requires all levels of government, the business community, environmental advocacy groups, labor, and individuals all to come together to act on climate. When the economy starts reopening, and as we think about our work, and frankly, since post-Sandy, much of the rhetoric has really been about building back better, right? We think New York is well positioned to jumpstart the economy with its strong climate laws and growing renewable energy industry and deliver on that promise of a clean economic future. So one of the laws that we spent years working on was the Climate Leadership and Community Protection Act, or the CLCPA, which became law last year. The CLCPA sets a nation-leading goal of economy-wide carbon neutrality by 2050, including an 85% reduction in total emissions, which is really a lot of work if you think about where we are today. That includes all sectors of the economy: energy, transportation, agriculture, manufacturing, buildings, every part of life that you think about. And holding all of these sectors accountable has not been done in the United States before, so we really think it's important that we do it right. So it shouldn't be surprising that the bill that was passed was not the bill that started out. It took a lot of people to get it where it is today. Elected officials and advocates on all sides work together to make it achievable and not simply aspirational. We know that it affects the entire economy, and therefore it had to be practical. It had to position New York to be a leader in the entire region's economy for generations to come. I think we're all seeing right now, right? Governor Cuomo has been careful that he wants to make sure that when we act, we're working in concert with New Jersey and Connecticut and some of our surrounding states, because if we go back to work, it has implications for those other states as well. And similarly, I think when New York takes action, because we're such a big player, it impacts what happens in those other states as well. We help build an economy of scale that Rhode Island just doesn't have. So we think that this was really critical, and we view this law, the CLCPA, as just the beginning of many more policies that will guide us towards a clean and green economy. Now, power generation and electricity is one of the first sectors that the state is addressing. New York used 161,000 gigawatt hours of energy in 2018, and it's forecast to use over 175,000 gigawatt hours by 2030, because we're going to be moving to electrification of our vehicles and of our heating systems. So that means our energy supply needs to be renewable if we're going to achieve carbon neutrality. We need utility scale renewable energy generation, transmission, and storage. We need to build more solar and wind projects, and the current pace of permitting won't get us there. More than 60 renewable energy projects were initiated under the state's existing broken process for siting renewables since it was enacted in 2011. Yet only 6 projects were received certification, and only one of them has started construction. So clearly, the current process does not match the urgency that we need. That's why last month, even amidst this public health crisis, Governor Cuomo and the state legislature still kept fighting climate change on the front burner. As part of the state budget, they passed another important bill, the Accelerated Renewable Energy Growth and Community Benefit Act. It will green our economy, create family-sustaining jobs, and help us achieve the climate goals of 100% clean energy by 2040. The bill streamlines the process by which large-scale renewable energy generation and transmission projects are cited. The improved process will support a clean energy economy and create green jobs here in New York that can't be outsourced. And we've been urging decision makers to improve the siting process for nearly 2 years, and it couldn't have passed at a more important time. Amid this crisis, this legislation is a critical tool that we think can help with the economic recovery after the pandemic subsides. New renewable energy projects will help meet the state's clean energy goals and climate goals. And critically for you, it's going to improve air quality and public health, and it's going to drive economic activity for New Yorkers. This is really a win-win-win. And we were able to get this done despite, as was noted earlier, the very bizarre circumstances and the climate that we're living in right now. You know, the Capitol has been closed since the middle of March. It's typically when it would be teeming with lobbyists and protesters. Lobbying was all done remotely. Legislators weren't meeting in person. Negotiators were hammering out the deals of the budget on an even more secretive basis than even usual. They were doing it by conference call. And even with all of that, we were able to mount a winning campaign. We had a coalition of strange bedfellows. Yes, we had the traditional advocates like environmentalists and the clean energy industry, but we were joined by labor looking for clean energy jobs and real estate, which needs clean power to reduce building emissions. We mounted an online ad campaign to highlight our support. We mobilized thousands of members of the community to email letters of support to elected officials. One of our partners was so successful with a call-in campaign, the legislature actually asked us to stop because they were getting inundated in their offices, and with people working from home, it was very disruptive. But our efforts worked. You know, despite working from home since March 13, we were able to get this big win to advance our clean energy future and set the stage for creating jobs that will provide family supporting wages. So we're adjusting to this current crisis, and we're fortunate to be able to continue to do our work remotely. Now, the power sector is a critical first step, and frankly, it's where we've made the most progress and where you're going to see a lot of improvements that can impact public health. But the energy sector is the easy part of the puzzle. Power producers are used to being regulated. And in fact, we found many eager partners in the energy sector who want to make the move, and they see the writing on the wall. But what about the other sectors like transportation and building? These may have massive behavioral shifts by New Yorkers themselves. We'll need to provide incentives for people to change their everyday habits, educate them about the importance of making those changes, and make going green easy. New Yorkers need to understand why taking public transportation and making their homes more energy efficient is important. But we also have to make it easier for them to make those choices than it is right now. Transportation is the #1 contributor to climate change in our state. And the best way for New Yorkers to reduce emissions from this sector is to take public transit, which is, I know, very challenging right today, given the public health crisis, walking, biking, and driving zero emission vehicles. And that's also why the New York League of Conservation Voters was a major advocate of congestion pricing. Now, congestion pricing is unique, something that's been unique that New York is interested in pursuing, where we basically said everything south of 60th Street would have to pay a fee to drive in Manhattan because buses were driving 4 miles an hour. So you can't have people rely on something that's so slow to get around town. It's something that has taken decades to pull together, and it started out as an idea to help New York City comply with the Clean Air Act, but it never got the support it needed from legislators. They were worried that their constituents would see congestion pricing as a tax. Now, once we got this critical crisis of transit and needing to really fix the subways, Governor Cuomo got on board and the idea picked up steam. We got a coalition that we helped lead called Fix Our Transit to spread public awareness about the benefits of congestion pricing. We brought organizations from across the stream together to seal the deal. It was again a story of strange bedfellows. The environmental and transportation organizations joined together with real estate and labor groups. We all agreed we needed massive funding to fix public transportation, decrease congestion on our streets, and decrease the emissions causing public health impacts. And that was a big selling point, that we needed to help deal with the public health impacts. And congestion pricing is a model that can address all of those things. You can see today by looking out in the city streets what congestion pricing could do and how the benefits we could reap from having that and reshaping how we think about our transportation. We see the measurable air quality improvements we're experiencing now due to the reduction in congestion because so few people are driving. Now, obviously, we don't want these air quality benefits at the cost of a global pandemic or near complete shutdown of the economy, but it does show us very starkly how much pollution is caused by cars. We're also working to reduce transportation emissions through other policies. We're pushing for electrification of vehicles on the road. We're advocating for more EV charging stations to reduce the so-called range anxiety, so people are more comfortable buying EVs. We're leading a campaign for clean school buses so that students don't have to breathe in dirty diesel fumes on their way to school. We're fighting for a low carbon fuel standard to incentivize the private sector to invest in clean transportation. And we're pushing municipalities to electrify their fleets. And while we're working on reducing transportation emissions now, our future work is focused on the building sector. We helped to advocate for a bill that the New York City Council passed called the Climate Mobilization Act, which mandates emissions reductions from large buildings across the city. And hence why the real estate community has been so interested in some of these clean energy bills. We're also working with state leaders to promote clean heating policies. Houses and buildings across the state, including New York City, are still using dirty heating oil. New York is the #1 consumer of heating oil in the country, and that causes a lot of particulate matter pollution in particular, as well as greenhouse gas emissions. So there are plenty of alternatives out there. We have biofuels, geothermal heating, electric heat pumps, but we need policies that incentivize property owners to replace their aging boilers or furnaces with more energy efficiency heating and cooling systems. And while it sounds like a very logical thing to do, when you're a homeowner and you've spent a lot of money investing in those structures in your house, you're not going to just turn them off and throw them out of the goodness of your heart. You need incentives to do that. So our future work will consist of advocating for policies to help address those. We also need to look at our waste crisis. We have become such a disposable society. Look around at our sidewalks the next time you go to the grocery store, and you'll see littered plastic bags and disposable gloves, and nowadays masks. Plastic straws and other single-use items are infecting our waterways. They're hurting marine life. Our landfills are overburdened. Programs that try to reduce waste, like recycling and composting, are being cut back for a variety of reasons, including the current economic crisis, impacts from the global markets, and the space that are needed for processing. It's very clear that we need to significantly reduce the amount of waste we generate in the first place. This is something that people don't often think about as a climate crisis, but it really is. All of those plastic materials are coming from fossil fuels. So we started with a ban on plastic bags and styrofoam, but we need to do a lot more. So we're trying to get people to consume less, to use more reusable items, to upcycle products when you don't need them anymore. And the reason we can do this successfully is because we mobilize our members to serve as advocates for the environment and put pressure on elected officials to make good on their promises. With COVID impacting everything, including our elections, we don't know yet how this year's political campaigns will look without in-person interactions and mail-in voting that will take place over a long period of time. But we're excited to figure that out. So what can you do? There are a lot of ways to get involved to start making a difference. You can take action in your own lives. There are many tools that show you how much emissions various activities that you participate in, such as a plane trip, if you remember what those are, or your drive to the supermarket, or getting around town, how you eat. One is a carbon tracker that Croton 100 put together and is available on their website, croton100.org. And it really allows you to look at your lifestyle and see where you can cut emissions. And then you can green some of your behaviors. Start with easy things. Reduce the amount of waste you generate. Stop using disposable everything. Coffee cups, water bottles, silverware, and yes, straws. Compost your food waste. Although I know New York State just made it a little bit harder last week when they started pulling back because of the budget cuts they have to take. Take mass transit or a bike or a scooter. Drive electric. But the biggest thing you can do is engage in the civic process. Write to your elected officials. Watch or attend debates and candidate forums to learn where candidates stand on the issues you care about. Work on a campaign if you'll get excited about a candidate, or if you want to make sure a person whose values don't match yours is elected. Fill out the census. That is really critical. I can't understate that enough. But most important, you need to vote. You need to cast your vote based on the candidates' positions on the things you care about. I'm hoping that those things are public health and the environment. We need to make climate change, protecting clean water and the environment a top-tier voting issue. We're making progress. For the first time this year, we had a whole forum that CNN hosted that was just about climate change for the Democratic, presidential campaign. But that's new, and it is really important because when elected officials know that their constituents care about an issue, they pay attention a lot more. And so that requires all of us to take action at the ballot box or with a ballot in the mail this year. So COVID-19 is teaching us what you already know, that we can't ignore the signs of a crisis. We can't ignore science. We can't let climate change be treated this way, especially not on this, the 50th anniversary of Earth Day. So I hope that you will stay in touch with us. We're working on a lot of issues, and we're very active on social media at NYLCV, or we have a mailing list that talks about all of the issues that we're working on at nylcv.org. And we want you to stay civically engaged and help advocate for the environment. So thank you very much, and I hope you have a happy Earth Day.
Thank you very much, Julie. Let me hand it over to Dr. William Rahm for the post-discussion introduction.
Earth Day began in April 22, 1970, 50 years ago, with 20 million Americans participating, 1 in 10. Primarily American in 1970, it grew to be global in scope, with 200 million participants by 1990. The environment was in terrible shape back then. Pesticides causing a silent spring, Cuyahoga River catching fire from oil pollutants, dirty air, few wilderness parks, and polluted land such as Love Canal in upstate New York. Earth Day led to the formation of the Environmental Protection Agency, the Clean Air Act, Occupational Safety and Health Act, and Clean Water Act. Regulations on just the primary air pollutants now save 220,000 American lives every single year. Earth Day was founded by U.S. Senator Gaylord Nelson. He later became counselor to the Wilderness Society, where I first met him in 2003 in Washington, D.C. Back in 1970, I was a medical student and organized a symposium at the University of Minnesota Northrop Auditorium on the Boundary Waters Canoe area for Earth Day. We heard from Dr. Clayton Rudd, editor of the Naturalist magazine, who had guided deep into the Boundary Waters Canoe area, and raconteur Bill McGee, founder of Friends of the Wilderness, who led the fight to create the Boundary Waters Canoe Area Wilderness Act in 1978. 50 years later, Dennis Hayes, the original field organizer of Earth Day, had planned demonstrations, marches, and sit-ins for almost 1 billion people across the globe. But COVID-19 changed all of that, and now 6 billion people are sheltering in their homes. The coronavirus originated in Wuhan, China, probably from bat to human spread. During January, I was teaching climate change at NYU Shanghai, and we heard about severe pneumonia in Wuhan, but we're not apprised of just how contagious it was. Today, we are focusing on the intersection of this global pandemic and the emergency crisis of climate change. Harvard's T.H. Chan School of Public Health studied air pollution, finding high levels of chronic exposure to particulate matter, very small, less than 2 microns across more than 3,000 US counties, associating this increase in PM 2.5 with mortality from COVID-19. In Europe, high exposure to NO2 from cars and trucks was associated with increased mortality from COVID-19 in northern Italy and Madrid, Spain. And of course, calling COVID-19 and global warming a Chinese hoax, ignoring warnings of experts and denigrating science has led to the severe pandemic in the United States. Instead of celebrating the 50th anniversary of Earth Day, we must now fight for Earth Day. EPA, instead of cleaning up air and water, is reversing our 50 years of progress, from leaving the Paris Climate Agreement to eviscerating the Clean Air Act, not changing the PM 2.5 standards last week, attacking the Clean Power Plan, methane, reducing the corporate average fuel economy, eviscerating the Waters of the USA regulation, backpedaling on mercury, gutting the National Environmental Policy Act, and so forth. So today we heard from our keynote speaker, Julie Tighe. She is president of the New York League of Conservation Voters and the New York League of Conservation Voters Education Fund since 2018. She is a example for NYU School of Public Health students to emulate in the future. The New York League of Conservation Voters has led the lobbying effort last year to pass the nation's most progressive climate law, the Climate Leadership and Community Protection Act. New York's climate leadership will cut greenhouse gas emissions by 50% by 2030 and reduce greenhouse gas emissions by 85% by 2050, with the remaining 15% to be captured or offset. 35% of the New York State Clean Energy funds will be spent in disadvantaged communities. She also has led the fight to pass congestion pricing for New York City. In her prior life, Julie worked for the New York State Department of Environmental Conservation, where she rose to chief of staff with 3,000 people working under her. She was a primary negotiator of the landmark $2.5 billion Clean Water Infrastructure Act and incorporation of the Climate Change Program in the New York $300 million Environmental Protection Fund. As she mentioned, she attended SUNY in Albany and is a graduate of the SUNY Albany School of Public Health, where she was in health policy and management. So she is a leader and an example for our graduate students to look forward to and join the fight for Earth Day and leading the battle to enact clean energy across the country and across the globe by 2050. So thank you.
Thank you very much, Bill. Really appreciate your remarks, and we really appreciate Julie's remarks. And it's really a pleasure. I'm accompanied now for the panel discussion by my daughter, Nadia. So I'm really delighted to welcome our panel. We're going to move on to the panel portion of our webinar today. And our goal for this panel discussion is, in a way, to let you sit in on what is kind of like our faculty meeting, because we have a very strong, very dedicated, very passionate, as you can tell, faculty. And I wanted to start with Dr. Jo Ivey Boufford, who really is a tremendous honor to be able to work with every day. And to hand the microphone over to Dr. Boufford.
Okay, thanks very much, Chris. And I want to thank the organizers for including the topic of cities and urban health in this Earth Day discussion. And since most of us are participating in this webinar at home, in our homes in New York or the general region, also talking, which is the epicenter of the COVID-19 pandemic in the US, I want to briefly highlight some of the unique characteristics of cities that shape our response to the kinds of health challenges we're experiencing now, whether from infectious diseases or also from natural disasters like Hurricane Sandy. It's really important to remember that cities have only very recently become a focus of attention in global health. SDG 11, being the urban SDG, is the first time the world has really agreed to set goals for creating resilient, livable, and sustainable cities with specific metrics to measure progress. And so you ask yourself, why now, focusing on cities? And the real answer is that the majority of the world's population live in cities, and this is expected to go up to as high as 60 to 70% in the next 20 years. And the other piece of it is the fastest growth of urbanization is in low and middle income countries. So while previously I think people felt the urban issues were high income country issues, they are now clearly global issues and need a global response. Also, while cities are the engines of the world economy, they also are responsible for 60 to 70% of greenhouse gas emissions, energy use, and consume the majority of the world's energy and generate 60 to 70% of the world's global waste. So one really cannot talk about achieving global health goals without tackling the issues of cities. This really has been very apparent, as Julie mentioned earlier, in the consequences of the shutdowns of coronavirus, when we've seen the dramatic improvements in air quality, in water quality, and in reductions in the use of energy. So obviously there are critical elements in the positives that we have experienced in the last few weeks. But there's also significant reduction in what cities do, which is to generate economic growth. And one of the questions that is raised then is, how will we decide to open up our country again? Can we balance returning economic growth and retaining the positive effects on our environment, energy use, and waste generation that we see happening now? And I would argue that there's a roadmap for this in something called the Health in All Policies approach. It's been around for a long time in global health, and the notion is that every decision made in every sector has the potential for being a positive or a negative effect on human health. For example, how one decides to reshape the transportation system, how one decides to deal with the issue of crowding in housing, decisions made about economic development and physical distancing, and the use of urban space. We have a lot of evidence to show what the positive decisions can be on the policy side to really create healthy conditions in communities. And we also need to think about rebalancing our healthcare delivery system, really developing the public health sector, the primary care sector, and balance and long-term care sector, so that there is a positive opportunity to have a well-functioning healthcare system without the kind of over-dependence on hospitals that I think has really been quite evident in this disaster. And we want to thank all of the health workers and the fabulous work that they have done for people that have been hospitalized, but much of the tension on these individuals coming from people using the hospital because they're used to using it when they may not need to if we rebalance the system. The key in all of these changes is also the equity question, and we need to make these decisions to address the health disparities that we know have been in poor and communities of color for quite a long time, but the light has been shone on them in a very different way in terms of the increased exposures and infections and the increasing death rates, disproportionate death rates from COVID-19 in these communities. And though many of us are living it, the unique characteristics of the urban environment that create special challenges for addressing pandemics like the one we're experiencing now were really quite evident in the Ebola outbreak in Africa. Individuals and health professionals in East Africa had been managing these outbreaks because they were largely in rural areas, and they knew how to, if you will, cordon off communities until the outbreak died. We saw a very different situation in the more urbanized West African communities in Liberia and others, where the infection rates were really unprecedented, and we had to deal with these urban characteristics that added complexity to the work. So what are they? First is the issue of density. Housing, transport, business, how to address the needs for physical distancing that we've been called on to do. A second is the diversity, the fact that cities have multiple cultures, languages, religious beliefs, and we must adapt our messaging and the acceptance of our public health messaging to the diversity of these communities by engaging them when we don't have a crisis, so that we know how to respond properly when we do. A third area is complexity. Most management structures in cities are quite complex, and the challenges that we've seen of bringing together multiple city agencies, bringing together government and private sector and civil society is a reflection of these complexities. And then finally, the issue of disparities, which everyone working in urban health thinks about all the time, and we can see in stark relief in the last few weeks. So what do we need? We need, and I can go into some of these issues in the discussion, but we need now, and I think it's been very clear that to deal with our urban challenges, we need the political will and good governance where government works effectively across the agencies and with the private sector and civil society to produce the positive outcomes, which would be decisions for health going forward from this pandemic as we prepare systems for the future. Thank you.
Thank you very much, Joe. I'd like to hand the microphone now to Dr. Jack Caravanos, another esteemed faculty member, clinical professor at the School of Global Public Health and in the Global and Environmental Health Program. Jack?
Thank you, everybody, and welcome to the seminar. Well, I was in high school during Earth Day, a sophomore in high school in New York City, and needless to say, it changed my life. It put me on the road where I am today, and I'm quite happy with that. I tend to say I'm a ground-up environmentalist from my early days. But looking back at the last 50 years, there is so much good news. And I tend to be a positive type of fellow. Our air is cleaner than ever. It's indisputable. Our water is safer than ever. We're recycling more than ever. And we're continuing to research and discover new environmental issues and health links that hopefully will get addressed through regulation. Of course, today, the environmental movement is practically defined as climate change. It's the 800-pound gorilla in the room, the environmental room at least. But that's okay. It transcends so many issues and is truly global. So how does COVID fit all into this? And I've been struggling with this, trying to relate all these topics, especially some of my work in low and middle income countries. And let me just say that on the negative side, COVID, climate change, environmental health, it shows us how vulnerable we are, right? So much has happened so quickly. And especially the poor and the informal workforce, not just in Zambia, but in the Bronx, in New York, in all cities in the US. We all know that in general, they're less healthy. They live in substandard housing, crowded housing, and I'm talking globally here. And we know that the overwhelming majority of deaths in this group are people with one or more chronic diseases. And poor air quality is definitively linked to chronic diseases. Many of them, it's all linked together. So we have a population that's heavily exposed, and then we have a COVID epidemic, and we have a disproportionate number of deaths in a very sensitive population, and the whole thing just cascades, and the rest is history. So that's some of the unfortunate side. On the positive side, I want to end on a positive note. It shows us how quickly we could change the environment, the atmospheric air quality. Delhi has blue skies. The water in the Grand Canal in Venice is blue and swimmable. Just look up these images. For the first time, the Ganges is drinkable after you chlorinate it, of course, which is a first in decades. European and Asian cities have drastic cuts in air pollution. You can see these maps, the satellite images. New York City air quality index is down 25% over the last 40 days. 90% of 103 cities in India have shown a 90% reduction in PM 2.5. I could go on and on, including China and worldwide. But what's really important is greenhouse gases. That 25% reduction in greenhouse gases over the worldwide, 18% just from China alone. So how we've been struggling with getting greenhouse gases down, who'd have thought an event like this can be so dramatic? And that's the lesson, is that we can quickly institute policies, change things if we put our mind to it and really believe in it and really get these change. Of course, are we going to forget this in September when hopefully life is back to normal? Will we forget the gains in CO2 reductions and air pollution reductions? I hope not. I hope some of this is sustainable. And I believe there's enough of us out there that will make sure it is sustainable. So those are my comments, and I look forward to some questions.
Very good. Thank you very much, Jack. Just as to the note of questions, on the bottom of your screen, there's a Q&A button, and we're encouraging you to ask any questions of the panel that you might come up with. We've already had a bunch, so I'm delighted to see that. So our next panelist is Dr. Alexis Merdjanoff, who is also quite an esteemed colleague at the School of Global Public Health. And Dr. Merdjanoff is in the Department of Social and Behavioral Sciences. And so I hand it to you, Alexis.
Well, thanks, Chris. Happy Earth Day, everyone. Definitely not the way we thought we would be celebrating this day, but still really important to recognize the great strides that we've made over the last 50 years, while recognizing that there's still plenty of work left for us to do. It can be challenging right now to think about the work that we need to do in order to protect our planet when we're in the middle of a global pandemic. Our lives have changed pretty dramatically over the last few weeks. We've seen the economy essentially shut down over these last 2 months. And as many other panelists have mentioned, the images, the satellite images of how carbon pollution has dramatically decreased during this time. But these are actually not new patterns. We've saw similar patterns emerge regarding carbon pollution following the Great Depression and also the Great Recession. And so while we aim to flatten the curve for COVID-19, we must do much more than just flatten the curve of carbon pollution. This is an opportunity. I think we have to view it as an opportunity. We can transform the systems that organize our lives and make them more resilient and also more equitable. We've gotten a glimpse into our ability to adapt during a crisis like COVID, and I don't know about you, but I find it to be pretty frightening. What it has shown us is how fragile but also interconnected many of our systems are. And here we are about to embark on a new normal as our economy slowly starts to reopen and we begin to figure out how to live in a world with COVID-19 until there's a vaccine available. And this is often what we hear from our participants in our long-term disaster studies. A new normal occurs after you've been exposed to a disaster. So how might our response to COVID allow us to build back better, as Cuomo has said these last few days, and simultaneously allow us to become more climate resilient? The research that we do at GPH and as part of the program on population impact, recovery, and resilience considers why some are able to bounce back or maybe even thrive after experiencing a natural hazard like a hurricane or tornado, while others may not recover or could experience even a downward trajectory. So essentially, we want to know, well, what does it mean to be resilient as an individual, as a neighborhood or a community, or even as a society? And at the heart of these questions is access to resources. Systems can provide resources, think access to safe and affordable housing, healthcare, or even critical information so that you can make an informed decision. It's becoming exceedingly clear from the systems that the systems that we need to effectively respond to these seemingly different emergencies, the climate emergency and the COVID emergency, that they overlap and intersect. So what might it look like to think about these systems in new and different ways? Well, there are a lot of possibilities. We could address climate change while addressing economic recovery related to COVID. Think federal assistance to transition homes and businesses to renewable energy, or fueling economic recovery with the creation of federally funded green jobs. These are ideas put forth by Rihanna Gunright, who is one of the architects of the new Green Deal. We could address underlying social vulnerabilities related to race, gender, income, age, immigration status, or occupational status that elevate risk not only to the effects of climate change, but also pandemics like COVID. This could involve improving worker protections so that you're not at increased risk of exposure just because you're showing up to work. We must understand that social justice around the COVID pandemic mirrors climate justice. We could address ways to improve our social cohesion and social support. These are concepts that we've found to be critical for recovering from disasters, but they're embedded in the ways that we live our lives. COVID makes this all the more challenging due to physical distancing guidelines. So can we learn maybe to use technology better to improve our social relationships and give access to resources that are needed during recovery? The goal behind all of these ideas is to create flexible systems that can adapt during a crisis, resilient systems, rather than shut down, and create systems that simultaneously address the inequalities that make these events even more harmful for socially vulnerable groups. Thanks so much, and I'm really looking forward to our discussion.
Thank you very much, Alexis. Our final panelist is Lena Sinha-Connolly, who's a member of the board of directors of FXB USA. So we're thrilled that you're able to join us. Over to you, Lena.
Thank you very much. Yes, it's a great privilege to join you in this webinar, and particularly, of course, on this day, 50 years of very, very important work by the Earth Day Network. I'm advising a foundation called the Foundation on Climate Restoration, as well as working with FXB USA, and they're both partners with Earth Day Network. And it is fair to say that the Earth Day Network has actually grown into the world's largest environmental movement, mobilizing more than 1 billion people around the world for the protection of the planet. And it has had impact all around the world, leading to regulations, changes in policies, and increasing global action to reduce emissions of greenhouse gases into the Earth's atmosphere. As many have said, and I think all the panelists have talked about this, it is now we have this crisis, and in a sense, it is as if nature has sent us a wake-up call with COVID-19, revealing our immense vulnerabilities. And we're all trying to see where this leads, how we're dealing with it, and the world has pretty much ground to a halt. Which of course is a good time to perhaps think about the larger issues. We're only now beginning to see the impacts of the global crisis we're in. Last week, the United Nations released a policy brief by UNICEF on the impact of COVID-19 on children, warning that while children are not the face of the pandemic, they risk being among its biggest victims. And it is a universal crisis, but for some children, the impact will be lifelong. The harmful effects also will not be distributed evenly. They're expected to be among the most damaging for children in the poorest countries and in the poorest neighbors, and for those in already disadvantaged or vulnerable situations. The economic hardships experienced by poor families as a result of the global economic downturn, UNICEF warns, can lead to millions more children falling into extreme poverty. These are the issues that FXB International, as a small international development organization, has worked on for over 30 years, providing seed funding and training to the poorest of the poor families in countries where it operates. The organization was founded in 1989 by the philanthropist Albina Dubois-Rouvray in memory of her son, François-Xavier Banot, who had died in a rescue mission in Mali. The organization is headquartered in Switzerland, France, and the United States, and it focuses on support for realizing the goals of the Conventions of the Rights of the Children. Early on, the organization developed a new multidisciplinary approach to eradicating extreme poverty, implementing programs that simultaneously tackle malnutrition, disease, unequal access to education, lack of income, and poor sanitation. And many of the programs have, for many years in different countries in India, Burundi, and other countries have actually emphasized such things as cleaning hands and also working on environmental impacts on livelihoods, etc. So very much many of these crises we're dealing with, they've already been at the forefront at the very lowest poverty level in communities around the world. So the model they work under is called the FXB village model, an approach based on the public health paradigm taught by the late Dr. Jonathan Mann of Harvard University, which emphasizes the link between health and human rights and the need for a holistic approach to break the cycle of poverty. And as the environmental crisis has affected programming and the recipients of the FXB Village programs around the world, they have increased their work on adaptation, resilience, and other aspects of climate change. And FXB has just recently also launched a new program called the FXB Climate Advocates Initiative to equip young activists with tools to mobilize climate action. The challenge of climate change is immense, as we know. And last year, the UN Special Rapporteur on Extreme Poverty and Human Rights released a report on climate change, warning that even under the best case scenario, hundreds of millions will face food insecurity, forced migration, disease, and death. This report quoted William Nordhaus, the 2018 Nobel laureate for economics, who described climate change as the ultimate challenge for economics. And David Wallace Wells, who wrote in his book, The Uninhabitable Earth, that global warming is worse, much worse than you think. In 1992, 154 nations joined together for the Rio Earth Conference in Brazil, signing the United Nations Framework Convention on Climate Change, which committed these nations to reducing atmospheric concentrations of greenhouse gases, with the goal of preventing dangerous human interference with with Earth's climate system. This goal has not been achieved, but perhaps as we today find ourselves in the midst of a devastating global pandemic, and we see how governments and communities around the world are mobilizing to stem the dire consequences of this pandemic, perhaps we can soon direct our attentions to a more meaningful way to the challenges of climate change.
Thank you very much. It was really, really terrific comments by all of the panelists, and I can tell from the notices that we've been getting on the Q&A that it seems to have hit a note with our audience as well. So I really appreciate it. So I'll start off our discussion. One of the questions that I have as a result of this pandemic, and especially related to climate change, but in global health and environmental health in general, is what do you think, and this is to the whole panel, what do you think the effect will be on the resources that are available to you as you would like to keep your work going, as so many resources are diverted now toward mitigating the effects of the pandemic? What's that going to do to public health, to global health, to environmental health, to climate change in the future? And I'll just welcome any panelist who wants to start us off. Perhaps, go ahead, Lena.
Yeah, well, I just actually saw a survey on this. It was a very initial survey 2 weeks ago. It was published by BBC. I think focused on humanitarian organizations, NGOs in Europe, in the UK and elsewhere. And of course, they were very, very concerned about the impact of funding for much needed programming to be diverted elsewhere now because of COVID-19. But more than that, many of them are concerned about the operations as there are, because they're all in their homes, not knowing if their organizations are going to continue. So I think there is a real concern of how this will impact the nonprofit world, but also perhaps an opportunity for organizations to reconsider how they work, and perhaps to try to really mobilize funding more directly to some of the really emerging crises, and to make this into positive, perhaps.
Jack or Joe, would you like to comment, or Alexis?
Yeah, I'll start, and Joe, you could take over. Going back to the point I was making on chronic diseases, I mean, when you look at who is getting most impacted, people with hypertension, tremendously large numbers, obviously chronic obstructive lung disease and heart failure. So if we could produce a healthier society across the board, I think that may be ultimately one of our strongest defenses and, of course, goals, because that's what we do in public health, is institute these interventions. So I think in some ways, it may take us off track, but if we go back to the fact that susceptibility is ultimately key when you look at who's dying and the social determinants of disease, it's exactly our work. Joe?
Yeah, I think I want to just piggyback on Jack's comments, because I think one of the challenges is that historically there has been appropriately a lot of focus in global health on infectious disease. And just recently, really, again, with the Sustainable Development Goals, we've begun to pay attention to some of the issues Jack's raising, like the long-term effects of cardiovascular disease and chronic obstructive pulmonary disease, diabetes, obesity, just really beginning to get a foothold on the concerns of the global community. So I think one of the challenges in the face of a pandemic like this is sort of shifting, losing what might have been a needle that was turning towards the center to have a kind of balanced attention to infectious disease and chronic disease prevention, which I think is a concern for the broader global health community. So hopefully what we've seen in terms of some of the people that are the most vulnerable to a pandemic like COVID-19 with the underlying problems of chronic diseases will help us rationalize and keep very present in people's minds the challenges of not separating these two pipelines and really seeing how they are critically linked to each other. And I think also to the issues that Alexis raises on overall mental health and resilience of individuals, which is a huge issue. All of these, they come together in cities, which is why it's interesting to me, but I think they're really important issues for global health in general.
Yeah, I just want to build off of what Jack and Joe mentioned, and I'm hoping that the COVID pandemic and also this focus on climate change for Earth Day is going to shine a light on the importance of the social and behavioral aspects of public health. There's a great deal of attention right now on creating a vaccine, but until that is ready, our best tools are social and behavioral interventions. And the same could be said for trying to mitigate the consequences related to the climate emergency. Our actions matter. And so understanding those actions and what we need to do and that we can take action collectively, I think that there's a lot of attention being shown on that right now, and it's critically important.
Very good. Thank you very much. I'm going to go to some of the questions that we've gotten from the audience. Early on, we got a note from Carly, who said there's inevitably going to be some backslide in the environmental progress across the globe once things get back to normal, or whatever normal is, post-COVID-19. What's the number one thing, this is the panel, what's the number one thing from your perspective that you think we can do to limit the effect of the backslide and to continue moving us forward to a greener and healthier future?
This is not my area, but I just want to highlight what somebody said earlier. I think Julie mentioned it, is the issue of transportation. I think decisions about the transportation sector are probably the most critical in potentially protecting us against going back to too much normal relative to the issue of air pollution, which is connected to all the other, many of the other chronic diseases we've seen and talked about.
Yeah, and probably including air travel, which was another question raised by one of the audience members, including that into transportation. Anyone else, Jack or Lena or Alexis?
Yeah, I'll chime in. I saw that question and I purposefully avoided it. But
good luck.
Let me deal on the free market side of things, the economic side of things, which is the weak will die off and the strong will survive. And I'm not talking about people. There are companies, there are airlines in Asia that are barely making money using very cheap, old airplanes, 20 years old, very polluting planes. So when you think of the whole fact that some of these industries may disappear, whether it's a factory, a coal plant, a power plant, what you're hoping is the people that take over, of course, the much cleaner companies, the Uniteds and the Lufthansas and those which have cleaner planes and cleaner industries. Hopefully the economic side of things, the capitalist venture side of things will take over. It's a little brutal, but I think it will happen. I know a lot of people they're on the line. Some of these companies that are barely making money with polluting industries, hopefully will disappear. Unfortunately, jobs will also disappear. So it's a tough one.
Lena, Alexis, would you like to weigh in on this? I haven't.
Well, I mean, I kind of feel like we should be tying a lot of, you know, policies related to climate into the bailout funds that are being given out right now. There's really no reason why we can't incentivize industries to address the climate emergency while simultaneously addressing COVID. It's an economic recovery. We heard for years that there's no money to address climate change, but we have money to address COVID. So I think that it's perfectly reasonable to think creatively and start to tie those solutions together.
Very good.
Well, and I would just add also the importance of the international cooperation on these issues, and the Paris Accord was a great advance. But of course now the next conference on implementation of the agreement has been postponed to sometime next year, and I would just stress the importance of all nations to really work on reaching their commitments, which very few countries have done so far. But perhaps this crisis could just regenerate public support, like Julie referred to. It's really about elections. If you really want something to happen, you need to give your governments the support from the voters up to the international negotiations, and make sure that everybody cooperate on climate change.
Well, I just want to add my own perspective. You know, for the first time in my career in public health, we have almost universal acceptance of the idea that prevention is way more powerful and effective than the cure, and a lot cheaper with respect to this pandemic. And we know it's the same case with climate change and with most of the variables that we deal with every day. And so if we could focus in on public health and on prevention, and maybe public health people will be the new rock stars in the post-pandemic future, that would be a pretty great outcome, not just for us personally, but I think for the planet. Okay, good. That's very, very good. Let me move to the next question, which is from Francesca, who asked us about particular neighborhoods in the US and how some neighborhoods might be able to be more resilient than others, and some communities might be more resilient than others. I mean, Joe touched on it a little bit with the density and the diversity. But what type of environmental factors might we want to include there? And I'm actually going to also include, if Bill wants to weigh in on this one as well, you're welcome to do. But this one has to do with neighborhoods that might be more or less vulnerable.
Well, I mean, just to speaking again in the urban environment, I think the disparities that have been highlighted here can be mapped. I mean, we know where geographically these communities are as we look at where the cases are, as we look at the disproportionate impact. And this equity question comes up in regard to a number of areas, like the availability of healthy choices in terms of food, in terms of safe places to exercise, in terms of availability of green space, adequate transportation, and obviously economic development. So I think this notion that Michael Marmot has put forward, that your zip code may be more important to your life expectancy than your genetic code, comes out loud and clear, because we can measure environmental impact, we can measure built environment impact, we can measure disease frequency and poverty levels in geographic areas, and it's one of the fundamentals of public health and also of urban health.
Alexis, did you want to weigh in on this? Sounds like it's kind of right in your area of expertise.
Yeah, I think a lot of this, especially in cities like New York, comes down to affordable housing. I'm sure a lot of the attendees have seen the zip code and COVID related deaths maps that have come out across the city, and you'll see areas like Manhattan, which are more densely populated than areas of Queens, have fewer impacts from COVID. So it's not just a density issue in terms of, you know, apartment buildings, but thinking about what Queens looks like, and maybe you have more people living in a smaller apartment or something like that. And so I think creating some way to allow for affordable housing, especially in New York, is really critical.
I want to actually ask Bill too, to make this explicit connection between environment, the outside air, and the risk of disease, particularly during the pandemic. So Bill, if you want to give a couple comments on that.
Yes. I'd like to echo what Lena said earlier about the importance of voting. The millennials and Generation Z all have an opportunity on November 3rd to vote for green candidates. The states of New York, Virginia, New Mexico, California, and Washington all have goals for 2045 or 2050 to have 100% green or clean energy. So November 3rd is really important for the federal election as well. And the League of Conservation Voters has prioritized certain candidates in states like Arizona, Colorado, Montana, North Carolina, and Maine as states where the candidate for the green economy have a real good chance of winning and turning the Senate. And the League of Conservation Voters this week just endorsed Biden's candidacy. And the importance of Biden now is that he has 6 committees working with Bernie Sanders to try to have a progressive agenda and meld the two campaigns so that the movement that Bernie has started will have an influence on Biden if he wins. So those are all important. And the millennials and Generation Z are the important young people to vote and turn the election this fall.
All right, thanks, Bill. So a couple more questions we had, and we'll maybe come back to, but we had a question from Kat about how we can convey the importance of climate change messaging to the public. And it's really a follow-on, and there's another question related from McKenna about public education programs to help the public understand the effects on public health. Is there anything the panel might suggest about getting the public on board in a way that will help to motivate them? What do you think it would take from your perspective? So I would say any of the panelists, Lena, Joe, Alexis, Jack.
Bill invited me to a dinner for the League of Conservation Voters, and I happen to sit next to the person responsible for doing this. I'm not going to I would just say that organization has people who are thinking about this and developing it in a multicultural, multilinguistic way, but I'll turn it over to Bill maybe to elaborate, but I know it's a big concern of the organization, so it might be a good thing for all of us to take a good look at what they're doing and try to piggyback on it.
The interesting thing about the League of Conservation Voters is that they not only advocate for candidates, they also are involved in policy. And they sit at the table in enacting green or clean energy environments.
Is there any other way that you think we can motivate people, Lena?
Well, I also think that I think it's happened already, but it really is an economic opportunity. If investments go to green transformation of the economy at every level, from transportation to buildings, it's going to create so many new jobs, and it's going to save people money if they don't have to work on the green, the old types of energy and all of that. It has happened. I think Al Gore worked for so many years trying to say this is not going to hurt jobs. It's going to help. It's going to create new jobs. It's going to create better jobs, cleaner jobs, and a cleaner environment and a healthier environment. And that message needs to be continued, I think. So it's not a losing proposition for labor or young people or anybody who is afraid of that transformation. It has to be positioned as it's a great opportunity for the next century.
I think
One
it's
of the things I wanted to ask Lena maybe to take a moment or two more on the training program for young people, to make them climate advocates, because we know pretty well that kids and young people influence their parents enormously, and obviously then it's the next generation that Bill referred to. So maybe you could just give an example of what you're doing. I know you're working here in New York and a couple of other areas as well around the world.
Yes, it's just launched, and it's actually just being developed. The climate FXB Climate Advocates which will help high school students or other college students as well, just to give them the tools to understand how they can get engaged. I think it's happening already among, I mean, even some of the youth movements that came out of the shootings in California. Others are working on issues such as climate restoration of the forest around the world and here. There's so many great movements, and the climate advocates that FXB is launching now, the program, will try to connect them to these different movements and give them some tools and say, this is how you can have an impact.
I just say that FXV is offered. We have one NYU grad student who will be an intern with FXV coming up, and a couple of other opportunities. So they're very open to people that are interested in working directly with them.
That's great.
I think, the other thing is that it's, education and putting resources in place in front of people are important, but I think taking advantage of the mindset that we're all sort of quickly coming together on is a good combination. The timing works really well. I think we have time for one more question for the panel, and I think we're going to leave it with Stefan, who sent us a note about any societies, or are there any places that you can think of on the planet that we in the United States might be able to learn from, that seem to be doing this better than others? And I'll just open it to the entire panel.
Well, I would certainly say places like the Netherlands, who have, I think what they do so well is that they've learned to live with nature, not fight it, which is something that us as Americans, we think that we can do, and we haven't learned that we don't typically win against Mother Nature. So learning to live with the changing planet, and how not just to fight against those changes, but to understand why they're happening, is a tremendous shift. But those are the types of countries that are really handling the climate emergency well.
I would just add, I think the Nordic countries generally are always kind of leaders in a lot of these sort of healthy world, healthy behavior, healthy environment movements globally, which I think that would apply as well. Obviously, the Netherlands is also immensely important in urban health and changing urban environments to focus on bicycles and walking and other things, which has huge effects. The other thing I think in the United States, and it's come up a little bit, but hasn't gotten the attention it deserves, is our Native American communities whose DNA is around living with nature and supporting it. We haven't done much as a matter of federal policy to support that, but there are many lessons that could be learned from our own American Indian communities here in the United States.
Iceland came to my mind as a country, which is very, very long used geothermal energy that they have as an island and so, but also many other countries such as Morocco, I think has now the biggest solar plant in the world. Other countries in Africa are trying to really see how they can instead of going into more investments in the fossil fuels, to kind of leapfrog the technology into solar and wind energy, etc. I think there's so many examples available. I can't think of a country by itself, but maybe Iceland is one of the ones that I would put forward. Scandinavia has always been very, very strong on this, of course.
Yeah, Jack?
Yeah, it's very tough, because we're so diverse. India is sort of structurally, legislatively similar to us. We have states, very independent states, but they're so much bigger and the structure is so different. And then I hear people say about Netherlands and Sweden, which are like the size of Brooklyn, you know. So I sort of chuckle when countries say, well, why can't we be like them? And we're so diverse in the US. So I think we probably have to look at the best of many of these different countries and what can sort of be applied. But I think even in the Times today, I was reading about how comparing numbers from country to country are so complicated with COVID deaths and cases. So trying to compare policies can just get orders of magnitude. I don't want to be a Debbie Downer on this, but it's a tough one. I chuckle when people say Canada is so wonderful, which is, you know, the size of Texas. So and much more, you know, much more different structurally. That's it.
Okay, well, good. Well, that brings us to the end of our panel discussion and the end of our webinar. And I really wanted to thank Drs. Rahm, Boufford, Caravanos, Merdjanoff, Sinha-Connolly. I really want to thank the audience for your kind attention and for being such a great audience with great questions. And I wish you all the very best in this incredibly trying time. I hope we get to see one another again in person soon. Stay healthy, stay safe, and really thank you for spending time with us today.
Thank you.
Thank you.
Bye, everybody.
Bye, everybody.